Lee Dilworth, Chief Executive Officer of ReVIDA Recovery Centers. We're here in Wytheville, Virginia, where we had our grand opening today of our newly remodeled treatment center for people in this community who are struggling with opioid use disorder. Our company began because I knew 3 young men who are no longer with us. Each of their stories started with opioids, and I realized what a tragic epidemic this is. This epidemic has cost families and communities, they've paid a heavy price, including this community here. And what we do is we come alongside individuals to help them to reclaim their lives from opioids. And by doing that, we are also helping to reclaim communities from this scourge of this epidemic.
I think what I love about ReVIDA is that it's a family-like atmosphere. All the people that I work with and work for are truly amazing people. Everyone that works here has an extreme passion to help this population. Either we're recovering addicts or people that have experienced family members. So they have a different kind of heart than someone that hasn't experienced this. With that, they can use that, the feeling, the experience, to go out and help our patients.
I came to ReVIDA because I wanted to help people, honestly. ReVIDA itself pulled me in because of how much they actually care about the patients. You know, their actual well-being, the patient's well-being matters more to us than the bottom line. Just to get to see people's life change, people get their families back, that's really important. So when you see families start coming back together and parents actually spending time with their children instead of just tolerating them being around and things like that, that's one of the most positive things you can possibly see.
At our treatment centers, we use a drug called Suboxone when medically indicated. And what that drug does is that it helps a person to not experience the withdrawal symptoms and the cravings that they have when they're in active dependency. It's particularly important with opioid use disorder. And then what's really important to us, very important to us, is providing robust behavioral health care programming that wraps around counseling, group counseling, case management, referrals to social services. Some of our patients need jobs. Some of them need food or food stamps. Some of them need help enrolling in Medicaid or other types of insurance programs. They need very basic things, or things that may be basic to many of us. Evidence shows that the more you can help a patient with their overall life needs, the more likely they're going to be able to control the dependency. So that's why we do it.
It works with the brain to alleviate the withdrawal symptoms and to block cravings. Medicine doesn't cure the soul, it doesn't cure the heart. That's why the behavioral health care piece is so important.
The staff at ReVIDA, many of us have lived the same life that our patients are currently living. Not only do we love working with the patients, but we love seeing that the work that we do transcends into the families of each of our patients. And those families are members of our community, and our community turns into the people that you run into at the grocery store, at church. It's every day, every person that you see every day, those are the people that we work with. And we feel like that the work that we do each and every day really is empowering our communities one person at a time.
If you love and are passionate about what you'll do, you'll never work a day in your life. I put in a lot of hours here, but I don't work a day in my life. I enjoy everything I do. Every decision I make is based on how it's going to affect the patient. I believe in this. I believe that we can have an effect on people. And I believe that people's lives can get better. I mean, I'm living proof. And that's what we want to accomplish through ReVIDA.